Welcome to hematology. Come on in. So we're going to check in to Hemoglobinopathy clinic here at the front desk. Hi, my name is Nicole. I am a registered nurse at the Hemoglobinopathy clinic. So we are a busy multidisciplinary clinic. We try and see our patients about once every 6 months or so. When they come here, they're seen by a hematologist. They also get like a TCD scan done, which is an ultrasound of the vessels in their heads. We also do a breathing test, so they're also seen by respirology. We also try and get them in to see a dietitian and social work and whoever else needs to see them, and try and be like a one-stop shop for the patients. So yeah, that's our clinic.
I'm Dr. Gurpreet Singh. I'm a pediatric hematologist at Alberta Children's Hospital. My predecessor and senior colleague, Dr. Mike Leaker, was the visionary behind this clinic. His vision and collaboration with other colleagues from respirology team, collaboration with the neurology team on the adult side, and other parts of our team, which included nurses. So it was a collaboration and discussion with them, and of course our families, who would benefit much more from bringing all the collaborative effort in one clinic instead of having them go to different clinics in different time and thus missing appointments. Often screening is offered in populations who have a high incidence of a problem, so that you can detect it and kind of do something about it. If the incidence or the is quite low, then a lot of people would not screen for those disorders. But there has been a significant increase in immigration as general to Canada. A lot of people who are affected with hemoglobinopathies come from different parts of the world who have immigrated. There has also been an increase in the interprovincial migration. Calgary is an important center for providing a curative therapy called transplant for these hemoglobinopathies. Our visionary, Dr. Leaker, and a visionary among the transplant team, Dr. Gilcher, have collaborated very effectively. We have close collaboration with them in terms of understanding when to do transplant, when to offer. Here we are very proactive, knowing that transplant, especially if done from a sibling that is matched, is quite successful based on the protocol that is being used here at our center. And so we often would have that discussion up front rather than wait for families to ask. And our team is amazing. I mean, it's just kind of decreases that burden a huge load. When I go to a hemoglobinopathy clinic, I usually go like, oh, we will interact, we'll talk. There's always help around. If I can't do something, our nurses will come up with a solution. If I have a problem, our respirologist will give another advice. So it's something that we all get together and we can do problem solving much more efficiently.
What's your favorite part about splitting that?
I think it's just like getting to see the kids grow up. It's chronic disease, and so it's something that they have for their entire lives. Like, it's sort of really neat to see them grow, and I think that's pretty amazing what we're able to do. You see their journey the whole way, which is really neat. So yeah. No, we have lots of family, a connection with them, and sometimes when it actually starts to show is when they're about to transition to the adult hospital. I think that is the time when they kind of bring up that emotion and say, hey, we've been here such a long time and we didn't even realize that all this care that we've been getting is just excellent. And when we get the feedback, the positive feedback of how good the care has been. So I think those kind of stories, when they come back to us, those are very heartwarming, encouraging.